Has there been any strategies you've noticed that might help with us in our job search? Like, for example, um, I think we used to think that remote roles were a lot more about, being more developed in public health. Um, Anything that you've seen as, like strategies for like how things have been changing lately,
Yeah. Yeah,
that
I
could help
mean,
us?
yeah, if you want me just to kind of give you my 2 cents on where to spend your energy or like what I'm noticing in the
Yeah,
job
what you've noticed
market.
lately.
Yeah,
Like one thing you
yeah.
said, like if you're looking for remote, then maybe it could be for if you're more developed in public health, or if you're just starting out, then you might want to focus around that community health and the local aspect. So what have you seen or heard of lately as, things have really rocked a lot or
Well,
changed in public health?
yeah, I appreciate the question. I think it would be a great way to end the office hours. So I think it's a very appropriate question. I think for all of you to kind of keep, pivoting and kind of maneuvering as you need to, what I've sort of been keeping a pulse on is how is the language changing and evolving, right? Not so much whether the remote work is there. Like the remote work isn't going away right now. I think I've been showing you guys some of that already, right? I think sometimes they just want you within a certain state and you can still be remote, right? Or you have to be within a region and it still can be remote. Whether or not you have a better chance of getting like an on-site job versus a remote job, I think it's still the same. It's still equivalent. It's still competitive because here's why. The assumption is that we assume that if our competitive pool is smaller, we have a better chance. And that's not true. Why? Because employers will hold out for the right candidate regardless. I'll say that again. Companies will hold out for the right candidate regardless of the pool size. So they are not going to take a risk on you, even if you think you have a good chance, because, oh, well, this is local and I'm sure there's less candidates. And, I was referred by someone. If you don't talk the language of the company and you don't pass their interviews, you don't get it, right? So that's happened to a couple of my mentees where they decided to do more local stuff, which is great. Yes, go ahead. But they assumed, right, that the offer was going to come. I'm sure I'm going to get it. I'm sure I'm local. I'm right here. This is my neighborhood. Didn't get it, right? So I think it's more be honest with yourself of if you start to look for more on-site, more hybrid, more remote, it's the same. It's the same as far as like the difficulty, right, of the interviews. So there's that. I'm going to put that aside. Separate from that, what I have been noticing is that companies are pivoting in the language that they're using or are highlighting work in a different way. So right now, areas that are growing, I had the list next to me, but I'll go off the top of my head and then I'll be repeating it. In fact, it might even be in my screenshot because I've been trying to mention it more in some of my conversations. But I also did an interview with Dr. Huntley. I believe that interview will be coming out on May 20th. I'll be promoting it and you'll be hearing more about these topic areas as well. But what I'm seeing is, for example, military and veteran health is alive and well. Okay. So there's a lot still going on with military and veteran health. So I'm noticing that while some places or some spaces, the work is minimizing. So for example, while there is still work in, say, like maternal health and child health, the angle seems to be more about immunizations, right? As well as comprehensive services and access to care, benefits enrollment, WIC, like those kinds of things are still kind of going on. Um, but from there, I'm noticing, wow, why am I easily finding a lot of like jobs for military health and military communities and veterans? Like whether it's private money, private donors, nonprofits, even the government is still pumping out that. In fact, I found a webinar, I might be promoting it, but it's for The VA is doing a webinar, I believe on May 14th. I'll find the exact date and post it, but on how to apply to federal jobs. So on May 14th, the VA is hosting how to apply to federal jobs because it clearly says that the Trump administration is standing behind our veterans and our military. So that's more of food for fodder, like kind of take that in as you will. But those jobs have not stopped, is what I'm noticing. And then the other spaces that are growing are still social impact, corporate social responsibility, right? So I think I'm noticing how corporations, like lately, I've been seeing Allstate do a lot of youth development. You know, that's new to me. Where did that come from? So they're maybe masking some of their work as youth development, but it could be around like, I don't know, is it social media? Is it marketing? Is it policy work? Is it youth empowerment work? Right? Only when you get into the job, you'll really understand what it entails. But yeah, I see youth development still growing. I still see, sorry, corporate social responsibility. Youth development is growing. I see knowledge management, learning management. I just said that one, or communities of practice. The space of programming, I mentioned, where they're really describing the work in that way. And then I've been seeing things like it's not community health, but community development, or it's not building capacity, but capacity development. So like, I'm just warning you guys that sometimes it's as simple as the work is just, they just do a slight tweak in order to then either mask the work or evolve the work or make themselves special, right? Because sometimes these companies just want to feel like this is our language, this is our contribution to the conversation. So yes, all of this to say that there are areas that are growing, others that are not as loud. But I think to me, it's still about the skills and how you're showing up. And then, yeah, I think even like what I just showed you with the CMEs, the adult learning spaces, if you search adult learning, you'll find a lot of jobs around coaching, wellness coaching, or CMEs like professional development, associations that do workforce training. So like it more is about how you're describing the work, right? If that makes sense, because you can argue adult learning is the same thing as a community of practice. I'm like, well, yeah, duh. But it depends on what the company is describing the work as, right? All of that to say, it's nonstop. Um, but that's the best that I've noticed so far. Yeah. Does that answer? As much as I can with the time we have. All right, everyone. Well, thank you for this. I hope this was helpful. Lots of work out there. Public health is still in high demand. I know it's still tough with all the changes happening, but I know that we are still in demand, and I'm going to be posting job alerts, hopefully reminding you of those that are currently hiring. And DM me or ping me if you need anything, okay? Here to help. All right, guys, let's get you hired. Have a wonderful week. Bye.